So the first question, in relation to what skills described in Chapter 7 and from the Leadership Skills Questionnaire would you use to secure needed resources such as staff? So related to our readings from Chapter 7 and the Leadership Questionnaire that we did, I would say basically every skill is needed to acquire and maintain staff. So as a manager, I would have to utilize many skills. In fact, the first one being planning. You know, you need strategic plans, or if you were to take something like acquiring more nurses so that your ratio could go down from 6 to 1 to 5 to 1. Your strategic plans would have to include things like the cost of hiring and your budget and getting that approved, but also how that would effectively maybe eliminate costs down the road. So you'd have to have long range plans as well. So you could say, for instance, well, this amount of staff hopefully is going to get our Press-Ganey, our HCAP scores in 5 years to this. You obviously need organizational skills and to understand the organization and model of care that your hospital or wherever you work uses. And that would be another thing that you would have to understand based off of model of care. If you're doing team nursing, for instance, you might need more staff. Utilizing staffing and directing as well, because you have to be able to staff if you need more staff, and if you need to acquire more staff like nurses as resources, then you have to understand staffing as well and the trends that go with it. And then directing, you know, you have to be able to implement your plan, manage your plan. And then as far as the leadership quiz, interpersonal, administrative, and conceptual leadership skills, again, you would need all of those skills in play to acquire resources. For instance, administrative, you need to know how to, who to go to. For instance, when we went down from 6 to 1 to 5 to 1, I know my boss had to come up with a budget and get the budget approved by his boss. So he knew the administrative role in that. Conceptual, you know, how's this actually going to work? Is there evidence-based research out there that can tell me how this will work, or have I done it before? And being flexible in that sense. And then interpersonal, what is your staff already like? Who are the people that are going to best fit in with these staff? And taking that into your hiring abilities, but also getting your staff around the idea of having team nursing or having a 5 to 1 ratio and change. So I really think you need all those skills. As far as the second question about an article that I would use to support the evidence, I found an article that was related to transdisciplinary teams and models of care related to dementia care. And the biggest takeaway from that was, you know, really and truly, it kind of speaks to horizontal organization and management, but also everybody having a purpose in the care of someone. And I think, you know, there's just good supporting evidence based off of the patient and putting the patient first. And the article, you know, said there should be a role for everyone. You know, you're going to have your MD, your nurse practitioner, your social worker, your nurse, your assistants, and they all need like a clear definition and purpose of their job. But the biggest thing from the article was that they had these great patient outcomes and caregiver outcomes for dementia patients. Patients were less stressed about their memory problems. They reported being more confident in their knowledge about Alzheimer's disease and related disorders and reported less depressive symptoms. And then caregiver outcomes that stated that they were less frustrated with dealing with the patients and reported less uncertainty with what to do with the patient, less concerned that they were not doing enough for the patient, and reported a better sense of control with more confidence. So to me, as long as you're always putting the patient first and the caregivers first, I think that can, and that research can transpire to, um, supporting you as a manager, wanting to acquire resources because, you can support it by saying, well, there's this study that's been done and these are the outcomes that they've had. There were plenty of other articles that said much the same thing. Um, so that was the article that I used to sort of support. The third question being, identify the levels and departments that you would need to work with. So I looked at New Hanover Regional Medical Center where I work. I looked at our organizational chart, and I know we used team nursing. That was a big push about like 2 years ago. Um, and our organizational chart is definitely a horizontal organizational chart, possibly even a little flattened. Um, but if you were trying to be a successful manager, say on a neurosurgical floor where I work, you would have to be involved with a ton of different, uh, let me see if I can find what I wrote, a ton of different areas and specialties. And that's sort of the purpose of horizontal management or horizontal organization is that everybody has a department and a purpose and we all work, together for effectiveness. So board of trustees, CEO, VP of the hospital, chief nursing officer, neuroscience head, VP of surgical services, the director of lean, the director of organizational operations. You talk about just at a daily level, being involved with float pool, being involved with techs from surgery, our staff and our techs. So those are sort of some of the departments, some people that, you'd have to touch practically everyone, even risk management, because it all sort of works together. And then lastly, the question about horizontal versus vertical, which you prefer. I definitely see myself preferring horizontal, just because I think it probably works better in healthcare, especially in a large organization like a regional hospital. Um, and for me, and this is straight from our textbook, it says horizontal, um, basically people have separate activities or departments for more efficient and effective performance, versus vertical where, it's sort of like a line of, um, hierarchy, which if you were to think about implementing that and people going always reporting to the same person,